Hi there. So in previous episodes, if you will, we talked about what are some key skills that everybody should know. And for me, first aid is pretty much top of the list, right? It's just way up there. So what we're going to do is we're going to do multiple videos, some on gear and some on skills. Now, I am not a doctor. This should not be taken as medical advice. I'm just a guy on the internet trying to help other people on the internet, right? So this just gives you an idea, maybe informational, maybe this is just what I would do, whatever type of disclaimer we want to go with. So again, this video, what we're going to do is we're going to talk about gear. I'm going to walk you through some of the things that I personally have. And we're going to talk about what other people should have as far as first aid goes, right? So also, there are a few useful links in the description of this video, and there will be additional links in future videos as well. So be sure to check out the description. Also, if you find this helpful, please be sure to hit that like button, hit that subscribe button, hit the bell, tell all of your friends, family, anybody on the streets so that we can help share this information. Now, we've talked before, purpose, skills, and environment. You always have to keep this in mind no matter what you're doing, right? What is your intended goal? What's your environment going to be like? What kind of skills do you have? So when we're talking about that, let's give an example of what we mean. So you're packing a first aid kit. Who's this going to be for? Is this going to be for you? Is it going to be for a large family? Little kids might have different needs. Pets may have different needs, right? So take all that into account. Now, is it meant to be general purpose, like Band-Aids, Neosporin, things like that? Or is it going to be meant for life-saving? So things like tourniquets or stopping the bleed or whatever. Are you outdoors versus urban? If you're outdoors camping and cutting wood and building fires, well, I mean, you're much more likely to get some kind of cut or maybe something severe, maybe burns and whatnot. Now, the size of your bag also matters, right? So you'll see, for example, myself, this is the bag that I keep in my car. And so it has multiple pockets, multiple organizations, right? So it's obviously a lot bigger than the one that I throw in my travel backpack. So space really matters. Another category would be, let's say, concealed carry, right? I always find it interesting that people will carry a weapon, a gun, so let's say, for example, and they're carrying it because they think that they might need to shoot somebody. I mean, let's face it, that's the reason, right? You may have to shoot somebody. Well, you don't think they might be shooting back at you? I mean, to me, if you're going to, it's kind of like going into battle with only a sword and not a shield also, right? So if I'm going to have a gun to shoot, I'm going to have some kind of, trauma gear for when they shoot back. So just something to think about. Now, I personally look at first aid in 4 parts, right? So whenever I'm building a bag, obviously, size matters. So the first 4 parts, so the 4 parts, there's basically everyday life. So these are like boo-boos, right? So Band-Aids, maybe Neosporin, maybe some Advil, Tylenol, typical things that you might run across. Then there's things that are specialized to you or your environment. So maybe your prescriptions, or maybe you have heartburn, and so you're prone to heartburn, and so you would carry that where somebody else may not. Maybe you're going to be doing a lot of walking, a lot of hiking, and so moleskin would probably be a really useful thing to have, right? So your environment, your specific needs. Also, there's life-saving. To me, having a first aid kit without some basic life-saving abilities is just not a good idea. Like, I would carry a trauma kit only as opposed to a first aid kit with no trauma. Now, do I expect for trauma to happen? No, but I don't expect for my house to burn down either, and yet I have insurance, right? I don't expect to get in a car wreck, and yet wear seatbelts. So, you want to prepare for things. And then the last thing is contingencies. And this is so, you've already taken these 3 into account, and then now it's, okay, what else might happen? Like, oh, maybe I'm traveling, so maybe I'll need some, way to stop diarrhea, or I'm really constipated, so I need a way to, let things flow, or I need, burn stuff, or I need splints, or I need, whatever. So you can really grow your kit here. You're never going to be able to prepare for every contingency. By the way, snake bite kits, that's not a thing. So please don't put any snake bite kits, sucking the venom. None of these things help at all with snake bite. So feel free to add all the contingency stuff you want. Just that's something I often see, especially here in Florida. People talk about all these things with snake bites, and that's not a thing, right? So given that, what I'm going to do is we're going to look at precisely what I personally carry. Okay, so if I'm traveling, I have a travel backpack, and I'm lugging this thing airports or everything else, right? So there's a few mandates. I can't really have anything sharp, no knives or anything. I can't. Size really matters, because it's that is in my backpack along with a lot of other things. So you have to have certain trade-offs. So these are the types of things that I would have in any emergency kit. Any first aid kit. I think a whistle is really important, because if you are in, especially some kind of trauma situation, you can yell and scream for help, but I'm telling you, a whistle is going to get people's attention a lot more. And you're going to want people to help. You're going to want people to call 911, blah, blah, blah. So that's not if you need a Band-Aid. That's if something serious happens. I also am a big believer of including one of these tiny first aid guides in every kit. Don't let the first time you read this be in an emergency, okay? But it's just good to, as a refresher, and you're stuck in the airport, and maybe just read up on some things. Also, a little magnifying glass can be useful. So I'm not going to go through every item, but I am going to point out a few things, all right? So one, some ways to do kind of repairs, if you will, improvising. So a thing of duct tape. Personally, I use Gorilla Tape, and it's just wrapped around a business card. So Gorilla Tape is used for a lot of different things. One is holding these different bandages into place. Sharpies, they can be used for a lot of things as well on medical, especially if you're doing some kind of tourniquet. You would write the time on the tourniquet, but you'd also just tourniquet and just write it on their forehead. So there's no question when EMTs get there, they know exactly what's going on. There's a lot of other uses for it as well. Now, I do keep these little folding travel scissors in here, and I've gone through a lot of airports. It's never been a problem. You are allowed to have scissors. I've not tested, whether they'll let me have trauma shears on there or not. I've been told that they will, but I just don't want to take the chance, because I've been told that, oh yes, this is fine and it's TSA approved, and then they take it. But I will say that these little scissors, I've gone through a lot of airports. I've never had a problem with them. And so having a way to cut something is useful. So tape and glue, and then some cord, and I purposely have a bright color. So this is kind of the trauma section. So, and we're going to go into a lot more detail in future videos about how to use these items and what they're for. But just in a nutshell, you want to be able to stop bleeding. And so, it depends on where you're bleeding. It depends on how bad things are. Again, we're going to focus on that on future videos. But we have a tourniquet. So this is a Cat 7 tourniquet. I like to have them orange, bright orange, so it really stands out. And I'll get to why there's a black one here in just a second. There's vented chest seals, right? So if you have some kind of wound in your lungs or something along those lines, there's a compression bandage. Sometimes you'll hear them referred to as Israeli bandages. There's lots of other things. There's some compressed gauze, maybe wound packing, some little regular gauze in case you just it's a little bit more minor. This is what's called an NPA, nasopharyngeal airway. So basically what you do is you'll put this up somebody's nose, right? And then it opens their airway. So, somebody not breathing, that's a bad thing. I also try to have some eye care in my different kits. So here's a syringe, it's sterile, and here's some eye drops. Things for burns, things for stopping minor bleeding. You'll notice I have sugars. Basically, somebody's having low blood sugar, right? So they're hypoglycemic, then ballpark about 5 sugars, right? And then wait 15 minutes. That will really help them out. And this, I've had to rely on this more than once. A little bit for, for stings, some alcohol, some antiseptic wipes, just a few Band-Aids, Neosporin you should always have in your bag, and then various things. The aspirin, essentially I keep 1 or 2 aspirin in each kit just for if somebody's having a heart attack. So you can have them chew on an aspirin. You're not going to fix that. You need to call 911, but you can have them chew on an aspirin to really help out. Obviously, basic pain meds, Advil, Tylenol. You can take both, by the way, at the same time. They actually do different things. They work on different parts. So some stuff, again, antidiarrheal, or you want to go to the bathroom, or you don't want to to vomit or whatever. And then Pepto, I find Pepto is a really, Pepto-Bismol, I find it's a really great kind of catch-all. I wouldn't say it stops diarrhea as well as like Imodium, for example, but it does a lot of other things that Imodium doesn't do. I don't know that I would say it fights heartburn as well as, say, Pepcid, but it does a lot of things Pepcid doesn't do. And so I really, if I could only have like 1-2 medicines in there, Pepto would probably be one. So these are the, poop, don't poop thing. This is the anti-nausea, the Pepcid, and we've got some Benadryl, and then activated charcoal. If you're not sure what you can do with activated charcoal, there's a lot of different things. We'll probably get to that in future videos. So this is what I would take traveling, right? So I try to, you'll notice I try to hit all these things, but obviously space matters. All of this fits in here, right? So, and you have to do different trade-offs. So like, for example, I'm using this compressed gauze. So this compressed gauze, this is 4.5 inches by 4.1 yards, and it's 6-ply. This gauze is 4.5 inches by 4.1 yards, 6-ply. This is the same amount of gauze, okay? This is compressed, obviously. I mean, this is like a rock, but you see which one is going to take up less space. Also, this is more useful when you're working with it. If you needed to, like, immediately to wound pack or something like that, it's easier to open. Here you're fumbling, you're trying to figure out how to open it. Here you have immediately, there's cutaways throughout the bag. So it's just really easy to rip open, and then it stays in place and you just pull it out as you need it. So, and then there's smaller gauze, right? So I'm bringing gauze. Well, what kind of gauze do you need? What's your space? What are you trying to do? Now, as far as the larger kit for this one, again, this is more of a contingency thing. I keep in my car. I'll be at the house. I'll have to go out and get some things. So again, I deal with the same trauma stuff, right? Except for here, instead of these little bitty scissors, I actually do have trauma shears. I have more options for burns. I have more options for gauze, more quick clot and stop the bleed and so forth, clotting sponges. Quick clot gauze also. What the quick clot gauze does versus just regular gauze is it's impregnated with what's called a hemostatic agent, so it helps blood coagulate quicker, right? And so in theory, it should stop bleeding faster. It's up in the air as to just how massively effective that is. I mean, given the choice between the two, I would absolutely go with the quick clot route, but you're talking, like say $2 for this versus, if you want the same size in quick clot, it's going to be like $30 or $40 or something. So it's a pretty massive difference in weight. Another thing for trauma that's important are thermal blankets, right? So shock is a real thing. If somebody's got blood loss, it's a real thing. There's lots of different reasons why people may need to be kept warm. Now, if you notice, I don't have one here because even though these are small, honestly, it just one won't really fit in here. I'm trying to figure out a way to make it work because I'd really like to have one in there, but so far I haven't been able to. Now, again, we've got the vented chest seals and the Israeli bandage, the NPA, also some lube, by the way. You don't want to stick one of these up somebody's nose. You want it to be lubricated. And so here's, a quick little thing of lubricating jelly. Then we've also got, if you notice, I have 2 tourniquets, actually 3 tourniquets. Actually, if you count this one, right, this is what they use when they're drawing blood. I definitely wouldn't want to rely on this, but I mean, for smaller kids or something like that, this might be helpful, or for dogs. or cats. So this is my main tourniquet. Tourniquets are going to do, they're going to work most of the time. There may be rare cases where you would need to apply a second tourniquet. And so that's why I have this one. This would be kind of a backup tourniquet. This one actually, so these are what are called CATs, right? Combat Application Tourniquets. These are the standards. This is what military uses. This is what police use. Like there's a whole bunch of different tourniquets out there. This is the one I would use. Then there are also what's called a SWAT T. Okay, so SWAT is stretch, wrap, and tuck. And so basically, this is a larger version of this. It's this elastic band. You know, it's that wide around. And so, yeah, you can use it as a tourniquet. I mean, that's its purpose, right? But it can also be used for a lot of other things too. Like little kids, they can't use these because their arms and legs are going to be too small. Your dogs, your cats, whatever. But this will work on those. This would also work in the place with a compression, compression like a regular compression bandage, like wrapping your ankles or whatever. It could also work in the place of an actual compression bandage. Have some gauze and use this, right? So this is like a really multi-purpose thing, and so I like having it as just as a backup. Then I have some kind of repair items. Here's my first aid guide again. Here's some basic repair items. This time I do actually have, like here's a Gerber dime. I really like this one. It's nowhere near Leatherman's, right? But I mean, as far as for the size, it's got knife, it's got scissors, it's got pliers, it's got tweezers, it's got all kinds of different things. For the size, you really can't beat it. I'm a big fan of, you need to have some kind of flashlight. Maybe you're working in the dark, or maybe you're trying to see if they're, has anybody ever shown their eyes, to see if their pupils are dilating correctly or whatever. There's a lot of different reasons to have a flashlight. Then I also have, of course, the whistle, but this has other things as well. It has like a built-in compass, which, yeah, I'm not going to have that if I'm out in the wild. I don't want that to be my only compass, but I do have a little bit of more of kind of emergency things in here as well. It does work. I mean, it gets me, points north, the correct direction. And then I have Gorilla Tape and Gorilla Glue. Same thing over here. Lighter, bank line, and paracord. Some PPE, so CPR masks, some gloves, masks, things like that. A little Right in the Rain notebook. Again, I'd like to put one here, but it's really tight fit as well. And so, you may think this doesn't add any room, but you throw that, Mylar blanket, and it really adds up. So with this one, the kit's a little bigger, so I have more options. So just like moleskin, I have this little piece of moleskin in my travel kit. I have a whole lot more moleskin here. Again, eye care. So eye wash, a syringe, no needles or anything, just to flush things out. We do actually have some tweezers, mirrors for self-aid. Again, I'd like to put a mirror in there, but it's been a challenge. Different safety pins and whatnot, Q-tips. These are really great, these big otters. You just put that in a little bit of water or whatever kind of liquid you have, and they expand up. And so these can be, they're like super, super strong paper towels, basically, like really strong. And that's probably a bad comparison to compare them to paper towels. I mean, they will rip, but they're actually pretty useful. And then a cotton bandana with some other, survival things on it. It's just kind of interesting to read or whatever. Then we have a splint. We're not going to get into using splints today, but this is, somebody breaks their arm, their leg, whatever, and you need to immobilize it, right? So you can use that. And it stretches out pretty big. Then also, cold compresses. In both cases, I do actually have electrolytes as well, right? So electrolytes are really useful. A lot of people skip them in their bags, but honestly, I mean, people are having heat stroke. People are, there's lots of different things where giving somebody just some water versus some water and electrolytes, it's really going to be a big difference. So then we've got different prescription meds. Again, this is more of a kind of an emergency thing. So we've got prescription meds for my wife, myself, my dogs. Similar medicines to there. I actually do have some antibiotics here as well that, I spoke to my doctor, was saying what I would like. So there's a whole bunch of different antibiotics, right? So like the Z-Pak is really good maybe for respiratory stuff, but if you're talking a general purpose, like I'm out somewhere and maybe I've got cuts or, infections or whatever, Z-Pak's not really going to be great for that. So what my doctor actually prescribed for me was doxycycline. So, $5-10, talk to your doctor, get kind of the right thing, and then you have some antibiotics, which can be really useful. I also have Ambisol. A couple of people in the family sometimes had, known toothache pains, and I tell you, man, if your tooth's hurting, uh, that stuff's gold. So again, with the aspirin and bee stings, I mean, very similar things. Obviously, a larger selection of Band-Aids. We have, obviously more gauze. Here, I actually, since I have the room, I do actually have some tape. Yes, you can use Gorilla Tape for these, and if that's all I had, that's absolutely what I would use. However, this doesn't stick as much, and so it's, if you're wrapping Gorilla Tape around it's going to just rip all my hairs out, whereas this is going to be a lot kinder to me. Mirrors for self-aid and whatnot. So again, this would all fit in here. This all fits into here. This is more of like my emergency things for the house, for the car, for whatever. Whereas, bug out bags or, preparedness bags. Whereas this is what I take when I'm traveling anywhere, right? It's a lot smaller. It can't do as many things, but it can still do quite a bit of things. And so you have to really think about these. And so what we're going to do in the next video is we're going to go through and talk about some of the skills that you would have, okay? These items are not really useful unless you understand what they do. So, for example, when I have these drugs, I use these little pouches instead of having, all these bottles and blah, blah, blah. I have these little pouches, and you can write, the expiration dates. You can, I like this one, for example. It says Pepsid, 20 milligrams. It's an antacid for heartburn. Take one as needed, and then the expiration date, right? So you want to go through and check all these different expiration dates. I mean, if something says that it expired like last month or something, honestly, again, not medical advice, just a guy on the internet talking. If something, I was with somebody one time where I asked if they had any Neosporin because I didn't have any with me, and they did. I looked at the expiration date, and literally it expired 20 years ago. Okay, so yeah, you don't want to use that. But I mean, if something, if you have some Pepsid or Band-Aids or whatever that say they expired last year, they're still probably pretty good. Okay, my antibiotics, whenever I get them, I usually let them be expired for 2 years, maybe, something along those lines, until I go and get some more. So I hope this has been helpful. Next time what we'll do is we'll talk about actually life-saving gear. So we'll go through and talk about using these. We'll talk about CPR, just various things. I mean, anybody can put on a Band-Aid. These tourniquets are not hard to use, but if you don't know how to use it, then it's still not good. By the way, I said earlier, I would point out why I have a black one here. For the cat tourniquets, to get a real authentic cat tourniquet, it's about $30. Okay, you can go on Amazon and get what looks like, it looks like the same thing, and it's $10. Problem is, there's a lot of knockoffs, and this one undergoes a lot more rigorous testing than this one. At the time, I was fine with, that's fine, $10, whatever. But then the more I think about it, well, this is, and you can go on YouTube, there's all kinds of different videos of people putting these through the tests. This will break before this one. So what my thought process was this is a life-saving piece of kit. So I replaced the tourniquets that I had, these, with the authentic ones. They cost more, but I think it's worth it. And then with the ones that I replaced, here's one okay, fine, I'll just keep it as a backup, right? Or worst case, if you had multiple, you needed multiples. Here, I don't have that one as a backup. And so the one that this replaced, I actually use that for training my family, right? So, you go through and you open up an Israeli bandage and show them how to wrap these things around. Or, a tourniquet. You think you know how to use a tourniquet until you actually do it. But again, this is going to be a life-saving thing, and you've only got seconds. And so you want it to be just immediate, know how to do it. So you should try it. And that would be my recommendation for everybody, is to go and get trained on things. Stop the bleed, basic first aid, things like CPR and strokes and whatnot. There's a lot of things that you can fix, right? And I'm going to go over several of those things in future videos. But listen to me, some guy on the internet talk for 20 minutes is not a substitute for taking, you know, a Red Cross course or a Stop the Bleed course or something along those lines. So again, I hope that this has been useful for everybody. Again, like, subscribe, and hit that bell, and join me next time where we'll actually, you know, go through and see what these look like, and see, you know, why you want 2 vented chest seals and what a vented chest seal does anyways, right? So until next time.